This program is rated PG. It contains themes and scenes which may not be suitable for very young audiences. Parental guidance is advised.
Be advised that the views and opinions of the hosts and guests do not reflect those of the station.
A dilemma is a situation in which one needs to choose.
Paano ako gagaling?
There's an ethical issue.
Enter the
Supposed
second
to
one.
help us or
Medical Dilemma.
Hi, I'm Sonny del Rosario and you're tuned in to Medical Dilemma. Abdominal pain can be caused by practically anything as trivial as gas to something as catastrophic as ruptured aneurysm. It takes more than gut feel then to understand what's going on in our midsection. Our guest for this episode is a practitioner of general surgery, the former head of the General Surgery Section, Department of Surgery of Makati Medical Center, and a consultant of the Asian Hospital and Medical Center, Dr. Antonio R. Macapagal. Welcome to the show, Dr. Macapagal.
Thank you very much. Good day.
Okay, Doc, for the first segment of our show, let's first understand, the practice of general surgery. First of all, how long have you been practicing as a general surgeon?
Since 1986, but 1980, I started training in general surgery, and we trained general surgeons for a period of 5 to 6 years.
5 to 6 years.
And then you take your boards, specialty boards, after the period, then you can practice general surgery as a consultant afterwards.
I see. And did you choose surgery as a conscious decision, or did you stumble upon it?
Yes, because I've always been interested in anatomy. Even in school, during the medical school days, I always hang around the anatomy laboratory and studied the cadavers very well because I've always been interested in it.
I see.
And it's closely related to general surgery, anatomy.
Anatomy, closely related to general surgery. All right. Now, in your current practice, what are normally the cases that you get on your table?
Well, the most common ones would be abdominal pain. We also see a lot of cysts, tumors, or masses in layman's term. Trauma, in the emergency room, gunshot wounds, knife wounds, even blunt abdominal injury to the abdomen are considered acute cases which needs immediate care.
Okay. And among these cases, what are the most common occurrences?
Well, the most common ones are the acute appendicitis, acute cholecystitis or gallbladder diseases. Then we have the tumors, the trauma. We also have seen a lot of trauma cases lately.
Okay. As a general surgeon, do you specialize in a particular case, or you handle this wide range of cases?
I trained in the 1980s. I was trained by general surgeons as well. It was during that period where we were supposed to know a lot of cases, which includes also urogynecologic cases, even orthopedics, vascular cases, neurosurgery as well. We rotated in all those subspecialties
I see.
as part of our training program. But you're not expected to really practice all these cases
Okay.
when you become a consultant. You would now be focusing on general abdominal cases, breast and thyroid, head and neck cases.
I see. So now there are subspecialties already. in
Nowadays,
general
you have pediatric surgeons, you have colorectal surgeons, hepatobiliary surgeons, and vascular surgeons.
Okay. Now, for this episode, our topic is about abdominal pain. That's why the title is Gut Feel.
Yeah.
When patients feel abdominal pain, do they go directly to you, or do you get these patients as referrals from other doctors?
In the emergency room, they are evaluated by emergency room physicians.
Okay.
And they are categorized as a medical acute abdomen or surgical acute abdomen. And from there, if they don't have any attending physicians, they are referred to us directly.
Okay.
If they have attending physicians, they are called in first and re-evaluated and sent to us if it's a general surgery cases, or they are sent to a gynecologist if it's an acute gynecologic case, a vascular surgeon if it's a vascular problem, so forth and so on, down the line of specialty.
I see. So there are cases that are directly referred to you from the
emergency room.
and there are others that are referred to by other doctors.
Attending
as well.
physicians, yes.
And you also get, I suppose, patients that go directly to you.
Yes, for some knowledgeable patients, they could tell if it is acute surgical
case.
abdomen, and they prefer to be seen by a surgeon right away, and usually given to the desires of the patient.
Okay.
In the emergency room, so if they want to be seen by a general surgeon, they are called in.
I see. So if a patient who is experiencing abdominal pain at the moment comes to a hospital, what would you suggest that the patient do first?
Well, our procedure is we evaluate the patients. We start with history. We ask them how it started, where it's going, how is the pain right now, and we also ask for the past medical history. This is the first time. Is this an occurring thing? And then we go to the family history as well. Is there history of cancer in the family? History of gallbladder problem, pancreatitis, so forth and so on. And then we do our physical examination. From the physical examination, you could see already where the direction is going, whether this is connected to the gallbladder, the appendicitis, or this is a medical condition.
Okay.
So then we make our first impression after those physical examination, and we have differential diagnosis. The differential diagnosis would be evaluated by subsequent laboratories or ancillary procedures like X-rays, ultrasound, so forth and so on.
I see. Okay, thank you so much, doctor, for that information. At this time, we'll have to take a break just for a few reminders from our sponsors.
So if I were you, I would be a lot more careful about what comes out of my mouth, especially in such a place where anything can spread like wildfire.
Why when you share something to a public, you find that experience, and that experience so rich it could change other people. Okay?
Like, there are other sets of it, so you hear it, you see it, and then you can smell the fireworks.
Now put it to the game by asking earlier in the practice.
Unique word here what next to
Something that I've learned is
words can inspire and words can destroy. Choose yours. Okay?